So dementia is not a diagnosis. Let me say that again. Dementia itself is not a diagnosis. I know that there have been many reports on social media about Wendy Williams having early stages of dementia, but dementia itself is not the diagnosis. And I think it's important for us to have this conversation because African Americans are twice as likely to develop a progressive type of dementia, but least likely to have the resources to manage the condition in a way that promotes quality of living. So let me give you some insight into what I mean by dementia is not the diagnosis. Hi there, everybody. I'm Dr. Macie Smith, the social gerontologist providing education, training, and caregiver coaching to help you and your families reach the next level of care. Let me start off by saying that I am not a medical doctor. I cannot prescribe any medications whatsoever. But what I am is a licensed social worker and gerontologist who specializes in the practice and research studying aging, Alzheimer's disease, dementia, and also family caregiving. Dementia itself is not a disease and it's not a diagnosis. Dementia itself is a group of symptoms or a set of behaviors that a person displays as a result of having a medical condition impacting the person's mental capacity or their cognitive ability. So in the case of Wendy Williams, there's a lot of reports on social media about her having early stages of dementia. If you're in stages of dementia, then that means the symptoms that the person is displaying is caused by a progressive disease. Well, let me back up. Dementia is caused by something. It could be progressive or it could be treatable or short term. When it comes to dementia now, the behaviors. So some of the progressive types of dementia is Alzheimer's disease, which is the number one type or the number one cause. It could be caused by vascular disease, which comes on as a result of someone having strokes, several mini strokes. It could be caused by Lewy body's disease. It caused by Parkinson's disease. It could also be caused by a medley of unexplainable brain diseases concentrating in the frontal lobe and the temporal lobe, which is also called frontal temporal dementia. But when it comes to treatable types of dementia, or what we call in the industry pseudo dementia or faux dementia, that means that the symptoms that a person displays, memory loss, confusion, disorientation to time and place, not able to rationalize or reason or to make decisions, finding difficulty making sense of things, maybe not being able to organize thoughts to make a comprehensive statement. All of those are symptoms. They absolutely could be considered dementia, but more importantly, it's what's causing dementia. Some of the treatable causes could be depression, it could be medication side effects, it could be medication interactions fighting against each other, it could be diabetes, it could be thyroid disease. These conditions causes behaviors and responses to things that are considered dementia. In the case of Wendy, let's look at what she's revealed to us. She has thyroid disease. She has experienced substance abuse and she's experienced depression. All of these elements could be causes of dementia, but these causes can be treated, right? So absolutely, we should be concerned. However, we should be very careful in how we use the term dementia. We have to use that term with intelligence. We have to use it with responsibility, because if it's just thrown out there, people who are really living with progressive types of dementia, it can be very hurtful. And because the reports are saying that Wendy has early stages of dementia, age is an important factor. If someone is diagnosed with a progressive type of dementia prior to the age of 65, that's considered early onset as opposed to early stages, and that's typically caused by a progressive type of dementia. Someone who has early onset, the disease itself that's causing dementia typically goes a lot faster than someone who's diagnosed after the age of 65. So again, it's very important to better understand what dementia actually is, and we have to be very responsible with our reporting. Because the term dementia is trending now, let's take time to get better educated about the signs, the symptoms, and the causes, so that way we can be better prepared to treat it. For more information about progressive types of dementia, head over to my website, www.dtconsultant.org. I hope you like this video, subscribe to my channel, and don't forget to click the bell so that way you know when I upload a new video. Until next time,